On January 30, 2020, the World Health Organization announced that a new coronavirus, which originated in the Wuhan region of China, was now a public health emergency of international concern, the World Health Organization's highest level of alarm.
I'm declaring a public health emergency of international concern.
Ago, the World Health Organization declared the outbreak an international public health emergency.
On February 27, Nigeria announced its first case, an Italian man on a business trip.
The presence of the first case of coronavirus disease confirmed in Nigeria.
With lessons from the Ebola outbreak in 2014, the Nigerian Center for Disease Control went into overdrive to stop the spread of the virus, especially at the heart of the most populated city in Africa, Lagos. By March 24, barely a month since the first case was discovered, Lagos had confirmed 44 new cases and 1 death. Following the advice of public health officials, the state government issued a statewide lockdown to curb the spread of the virus.
An estimated population of 21 million people are being told to stay indoors.
However, in a megacity like Lagos, a lockdown comes with many unpredictable circumstances. 8 months after the initial lockdown, we follow the stories of 3 women who rose above the circumstances and made sacrifices to support their communities. These are the heroes of COVID-19. When Dr. Alero Roberts, a public health expert from the University of Lagos, first heard about the virus in January, she started planning an extensive strategy for what she knew would be inevitable. Bringing her knowledge from the front lines of the fights against cholera, polio, and Ebola, her and her team of competent healthcare professionals provided high-level guidance to the Lagos state government as it battled the pandemic.
It's very difficult to define the role that I played as an individual because this is very much a team effort. So I think it'll be safe to say that as a public health physician, the Association of Public Health Physicians, particularly the Lagos State chapter, we all knew we had our work cut out for us. So we first heard about this, I would say, in the first week of January. And we were watching and listening for news. When it was declared a public health emergency of international concern, in all honesty, in Lagos State, at any rate, we went into action. We actually had the Emergency Operations Center up and running in January. We had identified the key actors, the key players, the key strategies that were going to have to be in place, because we knew that the one thing we could not afford was an overload of cases coming to hospital. So the gentleman walks in on the 27th of February, and we already had an emergency operations center up and running. We had our healthcare workers attuned, so there was already a very high index of suspicion. So we already had the strategies in place. We had identified where people were going to have to be isolated. We had identified quarantine strategies that were going to have to be put in place. And at that time, all the knowledge that we had, which was very, very, very little, we were already working to make sure that we could do the very best we can. We knew that our best strategy was going to be a public health intervention. We simply did not have the clinical capacity, the capacity for clinical management that higher income countries had. The strain personally came on each and every one of us that had to go out because there was a lack of personal protective equipment. Don't forget, this was started in China, which is literally the factory to the world. So the disruption in supply chains came almost immediately. And we had very little reserve, and that reserve had to be managed very, very carefully. But everybody was naturally afraid. Don't forget, at that time, the information we had about the pandemic was also little. Who did it kill? How fast did it kill? What were the symptoms? We were hearing such scary news from the higher income countries that we thought, my goodness, if that's what's happening to them, how is it going to hit us? We had no knowledge of how bad it would get, if it would get very bad, and we had to walk out to battle an enemy we could not see with weapons we did not have. So that put a strain, a huge mental strain on a lot of us. Then there was the strain of separation from family. For a lot of the frontline workers, the clinical staff, we had to separate them from their families. And that was difficult. Some of the issues and the reactions that we had to deal with at the level of the Lagos State Health System involved a generalized non-compliance to public health interventions. It took a very long time for us to get the public, the citizenry, to understand that this is a very serious disease. It can kill, it does kill, and the fact that a lot of people may be asymptomatic to it doesn't mean that those people were not in a position to spread it to people who are more vulnerable. So my first experience of a casualty of the pandemic was really close to home. And this was the father of a colleague of ours who caught it while battling an underlying medical condition. And it was a light bulb moment, because suddenly it became so very real, so very personal, and so very painful to not be able to do anything to mitigate the situation. It was even more painful when we lost a physician in the teaching hospital who hadn't had as high an index of suspicion as he ought to have had, and caught it while trying to save a mother's life. These are pinpoint instances where the pain becomes real, and you begin to think, this could be anybody. Of course, it didn't help that COVID swept through my household. I got it, my sons got it, my father got it, my husband got it, and he had quite moderate symptoms. We knew we were in the best position in terms of being able to access service, but that hadn't helped some people, and we had no guarantee that it would help him. With all that has happened, how am I doing now? It's a tough question to answer. I know I'm tired, fatigued from the very depth of my being, because we're not at the end. We're not at the end. That's number one. Number two, there's another one coming. If this could come, be sure there's another one coming. With climate change and what have you, there is no telling what new infections are brewing and where. And with the gaps that we have seen in service delivery, we know that we're not thoroughly equipped to handle the next one. So how I'm doing now? Phew! But we soldier on.
In the end, Dr. Alero and her team were pivotal to flattening the curve in Lagos, saving its fragile healthcare system from being overwhelmed. At the same time, about 30 kilometers away, deep in the heart of Ikorodu, Ajibola Babalola, a food scientist and digital learning entrepreneur, noticed an inequality exacerbated by the lockdown from watching her children adjust to the new normal of learning from home. She realized that lower income families would have to make the horrific choice between school materials and putting food on the table. Not want to see a problem and walk away, she launched the Learn with Notebook project, a campaign aimed at sharing 10,000 notebooks and learning materials to help the distanced learning of low-income kids.
Due to the COVID pandemic virus, it came in unannounced on everyone, including the schools and the children. So it has really put so much strain on them, because most of them don't know how to fit into this new normal of learning at home, new normal of learning through virtual means, new normal of learning from the TV. And we discovered also that some of them could not keep up with the pace. So most of them now have to form clusters, learning in cubicles, learning in shops. They went to distribute notebooks, and we saw close to 60 children in a very small cluster. I was wondering what they were doing there. They were practically learning. So it's really a strain on the family, because most parents could not even know the next step. They are not teachers. So most of them had to take up the role of teachers, have to put the children in school also, in small clusters. During the pandemic, I started the Learn with Notebook project, a project targeted at providing 10,000 notebooks to children in my community in Ikorodu, Lagos State. The aim of the project was to spur up the need for the children to keep learning despite not being in school, because we believe that a book and a pen in the hand of a student or a pupil gives him a reminder that I'm supposed to learn, I'm supposed to put something down, I'm supposed to keep on doing what I used to do in school. The experience has been fulfilling and also challenging, because going to those communities, most of them have high expectations of you. When you get there, they feel you're the government. They tell you we don't want only notebooks, we want something more. And it's really very difficult trying to draw the line, telling them that we are not the government, we are not a political party, we are just here to do good. On the 9th of May, when we started this project, the very first place we went to, when we distributed, a woman came out from nowhere and tore the books. She practically tore them and said we should send our reports back to the government that they need more than notebooks, that the children needed food, they needed money. And we were dazed. This is notebooks we got from fundings from friends and families, and you tore it in our presence. For us, it was a very discouraging outing, the first outing for that matter. But we're able to move on. Now, the interesting part is that same day, we got calls from children, because our numbers are written on the books, and they were appreciating us for the books we brought to them. And there was a day we went out and we met a fufu seller. She sells fufu, and she came to us asking if we could give her notebooks for our children who were to resume school the next day, lesson the next day. She was practically at the point of tears. We were so happy to give her those books. So it's really strange for people to understand that you can just do good for doing good sake. Every time we were to go out for distribution, as a mother, the first thing that comes to my mind is, where will I put my children? How will I attend to their needs while I'm on the field? Sometimes, my husband actually works out of the state. So whenever he's not coming home during the weekend, I usually look for someone to come over to take care of the children, or I drop them off in a neighbor's place. And, it's kind of strenuous. I've had strains on my finance too, because the project is purely funded by family, friends, and few NGOs. So anytime we don't meet up with the targets to buy notebooks, we usually take up from the family finances to augment what is actually left. Getting funds from family and friends has been exhaustive, because there was a point I had to open up to my family and my husband that I don't know who to ask for money again, because I've asked all my friends, I've asked all my families. I've had issues having a strain on my health and my team's health, because COVID-19 is actually a dangerous virus, and going out when everybody is supposed to be staying in posed so much threat to us, because you can't actually keep social distance when you're talking to children. They just want to cover you up, and can we get books? Some of them can even sneeze on you, and at the end of the day you get home, you wash up from head to toe. And there have been times where we had to distribute books under the rain, the days where we were drenched to our pants. It was so bad that we were shivering throughout, but in all, it's been fulfilling. One of the most interesting outcome for us with this project is the fact that we're able to, in our own little way, stir up an awareness of continuous learning. Now, taking a notebook to a community shows, it brings an image to the mind of the child that this is education. So for us, one of the greatest outcomes is that it has spurred the need for continuous learning. It has raised an awareness that you don't necessarily need to be in the four walls of a school to learn. You can learn at home, you can learn wherever you are. So that for us has been achieved. Another thing that has been achieved is that the children have seen that they are catered for, they are not neglected. And one of the ways I believe children can really be developed is through education. Personally, I'm fulfilled. I'm fulfilled that anytime I receive that call from those children, I feel that something has leaped out of my body, something has gone out of me despite my lack also. Like I said, I don't have everything, but in my lack, I've also been able to extend my hands to those around me. Even my volunteers, they've done so well. They leave their jobs, they leave their places of comfort just to do this project. For me, it's been rewarding, and I'm happy I'm into this.
Struggling to access resources quickly enough, the Learn with Notebook project continues to work to meet its target. So far, Ajibola has contributed 5,995 notebooks, and 5,468 pens and pencils in Ikorodu and Abuja. As the lockdown continued, more vulnerable families who lost their income struggled with a bigger problem: food shortage. Aderonke, Onipede, an NGO founder of the One Child, One Care initiative, took on the challenge to help the most vulnerable families.
The reality of poverty, of the complaint during pandemic was obvious. It was conspicuous because our office, like I said earlier, reside at the Magodo Sherry. So there's no how you will get to the office. When you drive through, you see it. It was glaring to their eyes that people needed help, needed support. Individually, most of us had people, even as members, because when we discuss on the group, people share their experiences. As members, everybody had a family or a friend calling to ask for 2,000 naira, 1,000 naira just to buy basic food needs. It was that bad during the pandemic. Everybody knows Nigerians live on day-to-day income. People that sell pure water will live for the 50 naira gain, or people that sell food on the road will live for the 500 naira gain. So it was something that no one could turn a blind eye to. You can't deny the fact that it was there. So it was right there, and we just knew that we needed to do something about it. We can't sit down and watch people suffer. People have needs. They reach out to us individually. We don't have the money. We also, normal average Nigerians trying to make ends meet. Most of us are on paid employment. Some of us are doing our own businesses, and we know how difficult these things are. So we just felt, okay, together as an NGO, we can raise. People trust us to this extent. People see us that we are transparent enough, so we can raise our voices and ask for donations and put these donations together. Get referrals, from people to refer families. We had to use the referral. That's even the unique part of it, because we felt these families are not on social media, so they cannot even see what this requests are. But there are people that know these families. Either they live around them or they live close to them, either in churches, in mosques, all over in the neighborhood. So they will reach out to us. So the unique thing was that we could now confirm the data they gave us and transfer the money. We are all to share the requests on our various platforms, social media platforms. And so when we got requests, we got loads of requests, over 1,000 requests from people seeking for fund and support. And so we had a committee that was calling people. We had like 4 of them that called to confirm, what their actual need is, just to be able to classify which one was going for who. And of course, then we had members that did the background check. Someone would go on Facebook to check if what they were claiming was true. Yes, that couldn't meet the low income families, but it helped a little because all the requests came from referrals. People had to refer you before we can support you. After running the online COVID palliative fund, we realized that there was so much needs. Truly, we had over 1,000 entries. We could not meet all because we were limited with fund. Whatever donations we give were basically from funds, so we are limited. But we're able to receive food materials. We were able to get food items. We had 1 or 2 partners that donated food items to us. So when we got those food items, that's got us excited and told us that means we can do something with this instead of just sharing this. This is small. Can't we get more? So when we started telling people that we're going to do food palliative, not even fund anymore, people were like, okay, this is good. Let's see how we can support you here and there. So we're able to get more food, bag of rice, cartons of noodles and all that. So we're able to pull that together, for the community. And we just felt, let's see this time around let's reach out beyond online. Let's do a physical, support for these people. When we got to this community, the palliatives that were full of 2 trucks looked as if it was nothing, just like a bucket. It was so little compared to the number of people that needed it. The families that received the palliatives, I can't share all. It was overwhelming. Most of them don't even know me. They don't even know me. The people that called them can share more on that because they called them back. Some were even cutting the calls and they kept calling, and all they wanted to do was just to say thank you. It was overwhelming. They didn't expect the money. They even felt it was government because they felt, how can an individual NGO do this much? So you get them send SMS, we still have them on our phones. People send SMS, kept praying and said they weren't expecting it, that you don't know what you have done to our family to save us from hunger. Some were very smart. They divided the money to use a part of it to start their business. They told us this much. use the other part. And there was a physical one that I personally experienced. I went to the market one day, and these two young men, elderly, not very young men, but middle-aged men, walked up to me and said, "You were among the ladies that shared palliatives," they spoke in Yoruba, shared palliatives in the community. My wives were so happy, I was so happy. That week you were our saving grace for that week. And the effect on the bottom line of all the projects we had during the COVID was we feel is maybe not physically, maybe there's no transformation in this family, is having a new house or new clothes and all that, but it was a need at the particular time, and we were able to meet that need. So maybe we've crossed a few T's, maybe not all the T's, but if you focus it, we made some dots, we've made impact in their hearts, because the feedbacks keep coming in, and that shows that the effect has been massive to this family, especially at that time of need. There's a time of want and there's a time of need. So at that time of need, we're able to reach that bottom line for these families, and I think that's fair enough. For those who would like to recognize who did amazing work on the front line, is no one else but our members. Our members were amazing during the COVID period. I shared that we had members, that were always there, always available, both online and physical, to be at projects, to be online, to 2 a.m. We are talking, we are chatting, and they are always there. So it's just the members, the donors, and of course, our friends.
Focusing on low-income and special needs families, Aderonke organized a food and fund drive that supported over 400 families with over $10,000 and 3 truckloads of foodstuff. As she leads Africa, we celebrate every woman who rose up to the aid of their families, their friends, their community, and their country during the period of this pandemic. We cannot thank you enough. Keep leading Africa.